Okay, excellent. Hey, how's it going? Thanks for joining my live stream. Just hanging out tonight. Going to be on here for about 45 minutes or so, answering some questions. Hey, what's up? Thanks for joining. Got a couple people in here. Nice. If you have any questions, just shoot them in the chat. Hope everyone's having a great night. I had an okay Monday. For those of you who don't know, I'm an orthopedic hip and knee surgeon. I specialize in outpatient and rapid recovery total joint replacement. Hope you can help me with my shoulder. What's going on with the shoulder? Hey, what's up? Thanks for joining. Appreciate all the support. If you guys have any questions, just drop them down in the chat down there. I'll try and get to them as best I can. For those of you who don't know, I'm an orthopedic surgeon. I work in Washington, D.C. and Maryland. Going for a full replacement right side in 3 weeks. What am I in store for? Is it a knee replacement or is it a hip replacement? A hip replacement operation is hip replacement's a little bit more easier to recover from than a knee replacement operation. Has a person ever passed away while you were doing surgery? There was a time when I did work in a level 1 trauma center where I saw a lot of trauma. Most of the time, patients didn't pass away during surgery. Even if they got shot a bunch of times, you could at least stabilize them, give them enough units of blood, get them up, get them over to the surgical ICU. So very rare for a patient to pass away during an orthopedic procedure. Now I do operate on sick patients, meaning if a very old lady, like I've operated on a lady who was 106 years old, and she had fallen and she broke her hip, and after she broke her hip, she needed to recover. But anytime you break your hip, you can have a mortality within the year is very high. It can even be 30%. But usually that doesn't really happen in the operating room. Well, I actually was just on a plane. I had a wedding I was attending. Just got back from Columbus, Ohio. So it was hot there today. So I just landed not too long ago. Yeah, it seems to be hot all over the country today. So appreciate everyone joining. I appreciate all the support. Any double taps, any likes, help share the live stream. We'll get some people's orthopedic questions answered in here. I'm 30. I had a hip labrum tear 2 years ago. Now I'm having synovitis. Depending on if your MRI shows there's a hip labrum tear or if there's any arthritis, sometimes you can go in there with a camera and clean it up. If you need to, in the worst case scenario, a labrum tear can progress onto full arthritis and you may need a full hip replacement. No, I just shaved. I shaved today. Long weekend. Are you taking PA students for clinical studies? I do work with some PA students. I have a physician assistant. Sometimes some PA students will be shadowing her. I don't have a PA student program, but I do have people observe what I do, whether it's medical students, PA students, nursing students. I'm basically bone on bone with my left knee. What are the pros and cons of surgery now versus later? Well, a lot depends on what age you are. The implants we have are very good. They're lasting 25, 30 years. And with 60% intact, we're letting people be very active on them. And so it really depends on quality of life. If your quality of life is affected, if your activities of daily living, meaning things like making food or using the bathroom are painful, then a knee replacement for bone on bone can be a very good quality of life procedure. So there's not an age cutoff. It's really a symptom cutoff. If you're very symptomatic, then it could be a really good procedure. I had a total knee replacement a year ago. My knee is still swollen. Swelling is one of the things that can take a time to come down. Sometimes your operative knee may never be as the same size as your non-replaced knee. The real goal is pain and function. So hopefully you have a lot less pain. Hopefully you're more functional on that side. Knees can remain warm. Knees can remain a little bit swollen after a replacement. Thank you. I appreciate it. Let's see. Let me get some of these comments. Are you on Facebook? I do have a Facebook. I'm not as active with it. I'm really active on YouTube, TikTok, and Instagram. The best subspecialty in orthopedics. So I really like hip and knee replacement in orthopedics. The reason for that is patients get better. You get them up, you get them walking again. Overall, spine makes the most money, but a lot of spine patients have issues. I mean, you saw the whole situation in Tulsa. That was a spine orthopedic surgeon. So. Would a person getting a knee drain have to be done in the operating room? You do not have to go to the operating room to get your knee drained. I will say, if we drain the fluid out, then a lot of the times the fluid can just come right back. It may be helpful to inject some cortisone to calm down some inflammation in the knee, find out the root cause of why your knee is swollen, and figure that out and fix it. Does bacon need to be crispy or chewy? Okay, what do you guys think? You guys put in the chat. How should bacon be, crispy or chewy? I go with crispy. I'm a crispy bacon guy myself. Knee not going straight after an ACL surgery. So you can develop something called arthrofibrosis. Arthrofibrosis means scarring in the knee. And if you have a lot of scarring in your knee, you may not be able to get it straight. You may not be able to flex it all the way. I would say until you're a year out, then you need to keep working on range of motion. If it's really behind, you can do what's called a manipulation under anesthesia. When you say people talk after surgery, do you mean in the operating room or in the recovery unit? Hopefully that didn't mess anything up. Well, so I use what's called a short-acting anesthetic, meaning it's a local anesthetic and people are asleep, so they're not awake for the procedure, but they have a light sedation. So by the time the procedure is ending, patients are waking up. So I can have a conversation with the patients as they're leaving out of the operating room. And so the goal is to get them up, get them walking right away. And that's kind of the most important thing. So I talk to my patients pretty soon after surgery. We're getting them up or walking them 30 minutes, 45 minutes after the operation to get you moving. Spinal stenosis means you have narrowing of your spinal canal. That can be very painful, a very difficult disease to deal with. Can you strengthen your shoulder muscles around the torn rotator cuff? Yes, you can. The rotator cuff has 4 muscles. You have the deltoids, you have your trap muscles, you have your rhomboid muscles, your serratus muscles. All of those can work to kind of strengthen up. We call it periscapular strengthening as well as rotator cuff rehab. Try and get that rotator cuff to heal. Sometimes we'll do cortisone injections for it if it doesn't get better. Yes, I do have physician assistants. They work with me as a first assist, and they also see patients in clinic. Thanks for all the follows. Thanks for all the double tap support. I really appreciate it. Important of physiotherapy role. So physical therapists are incredibly important after any type of orthopedic operation. The goal that we have for any type of orthopedic procedure is a sturdy fixation of the bone that allows for early weight bearing and early movement. We want people to get up. We want people to move. We want people to get back to doing what they're doing. In order to do that, we need a good fixation. So that's what we hope for. And therapists help to get people better. Most people are out pretty good during surgery, so they're not talking during their operations. Ortho surgeon from Nepal, what's up? I hear Nepal's a beautiful place. There's a great hike that I want to do there someday, but I think I have to take. I think the airport to get into the one of the ones in Nepal is like the most dangerous airport, but Nepal is beautiful. So hope everything's going well over there. I have a PAO done. Have you ever done one? PAO is periacetabular osteotomy. It means we're cutting the bones around the hip and shifting them. It can be done in a young patient who has what's called a dysplastic hip, meaning their hip is not normal. And it can be a good procedure in the right patient. I'm not doing a lot of them. I usually treat them if they progress onto arthritis. It's a big operation. Sometimes a hip replacement could be better than a PAO, but it really depends on the patient, the age, and what your hip is actually like. A lot of people have the same complaint. So my doctor did a rib graft for my rhinoplasty, which is a nose job, and my rib hurt more than the nose. And so whenever a surgeon takes a bone graft, whether it's from your pelvis or for your nose, people tend to complain that the donor site has more pain than the actual surgical site. Thoughts on partial versus total for young patients. So a partial knee replacement, there's that's really good that the PAO was great for you. That's amazing. There's the thoughts on partial knee replacement are a couple different ones. One, you should have an ACL if you're getting a partial knee replacement. You don't want the deformity to be too much one way or the other. They need to be very stiff or to be very obese. So age does play a role. Also, you don't want there to be arthritis in other parts of the knee. So that would be what the decision to convert to a total knee replacement would be. So also partials, the longevity is not quite as long as total hip replacement. Or the longevity of a partial knee replacement is not quite as long as a total. Knee and hip bone contusions after car accidents, those can be almost as severe as fractures, can sometimes take even 6 months to heal and be pretty painful. At 66, my right knee is bone on bone most of the time, and I'm fine. Any harm in waiting? No harm in waiting. If it doesn't bother you that much, then no big deal. Let's see. No, I really perform just hip and knee replacement. I don't perform spine surgery. I'm 16. I had a fibula fracture. Let's see. Had a surgery, plate, and screws. When will I be able to play sports? Usually people are playing sports about 9 months to a year after any type of big fractures. Blew out both my knees. Constant pain. Yeah, so once again, joint replacement is what we call an elective procedure, meaning you only need it if your quality of life is bad, if your activities of daily living are bad. Even if your x-rays look terrible and you don't have a lot of pain, then you don't need a joint replacement. It's when you feel like you're ready for it. Do I deal with EDS or Ehlers-Danlos patients? Yes, I do. It can be an incredibly debilitating condition. Sometimes people with EDS can develop what's called AVN or necrosis of their hips, which can be even more painful. The problem with EDS is the connective tissue is too loose, so the joints are moving all over the place. Appreciate it. Thanks for all the support. Do patients have to do a steroid injection before knee replacement is considered? You don't have to do a steroid injection, but it's usually recommended. Like, why get a knee replacement if you could get a steroid injection and it buys you a year or 2 years relief of time? So it's always a good option. I would definitely recommend trying a steroid injection before a replacement. Knees make it hard to walk. The goal is for every pound you lose, it takes about 4 pounds of pressure off the knee. So that can be one thing you can do, but it may be helpful to get an appointment, maybe try a steroid injection. What approach do I prefer for total hips? I do a direct anterior approach for my total hip surgeries. Thanks for the follows. Well, in order to do a TV show, I would have to take some time off from my day job, which can't quite do. I broke my left kneecap twice. Afraid it will never be normal again. One of the ways you can develop arthritis, we call it post-traumatic arthritis, is if you break a bone or break a kneecap or break a joint, then it can cause a lot of discomfort and pain. And so there are people who break around their kneecaps who need joint replacements down the line. I get gel injections and feel great. Gel injections is an alternative to cortisone injection. You may hear it called hyaluronic acid, Synvisc, Orthovisc, things like that. Those are all medications that can provide nutrition, lubrication to the joint. Those can help kind of decrease pain and buy you a little bit more time until needing some type of replacement surgery. How do I get rid of scar tissues around my knee? You can do deep quad massage. There's deep massage techniques to try and break up scar tissue around the knee, and stretching, obviously. You're 71 this week. You have bilateral knee hip replacements, and you had a PE. So I give a blood thinner after all my surgeries, and I get patients up walking pretty quickly, and that helps prevent blood clots. So risk of blood clots actually very low. I haven't had any patients recently have any PEs after any joint replacements. It's a risk, but make sure they're on the correct blood thinner, make sure they're properly anticoagulated, risk stratify them. The body weight limit to get a knee replacement. So there really is not a body limit cutoff. You want the BMI to be under 40. If the BMI is under 40, that's a good weight to be at. So BMI is based on your height and your weight. And so you can modify that. There's different risk factors that you can modify to make patients have a less higher risk of infection. Thank you. I appreciate it. Osteoarthritis can be the result of a couple different things. Osteoarthritis can be from trauma. It can be from family history. It can be from autoimmune diseases. It can be from medications. It can be idiopathic, meaning it just comes up. So there's a lot of reasons that arthritis can develop. And arthritis, what it really is, it's destruction of the cartilage, which is the protective lining of our joints. Let's see. How much does it cost for a knee replacement? Well, the good thing is the cost is covered by insurance in the United States. So that's a good thing. So cost is usually very minimized. It's based on patients' insurance plans. Was medical school or residency more stressful? Well, I think they both were pretty equally stressful. Orthopedics is one of the most competitive specialties to match in. So you have to have really good grades. You have to do well on your board exams, your step exams. You have to have research, good letters of recommendation. So they were both difficult in their own ways. In residency, you're working more hours. You're not taking tests per se. You do have one test a year, but it is a basically comparative test, meaning you're taking a test comparing yourself against all other residents in the United States. So there's more hours that are demanding. There were some weeks I worked 80 or 100-hour work weeks in residency. So it's all better once you get out and you're out past all that. Still have knee pain 6 months after total knee. It's mostly in the back of the knee. Sometimes with swelling, you can develop a Baker cyst back there. I would give it about a year to see if you're okay. Yeah, I went to LSU for undergraduate school. It was a great time. I had really good friends there. It's not the same hustle and bustle of day-to-day life. And, everyone should have a good time in their undergraduate studies. Arthritis is painful because what arthritis is destruction of the cartilage. When the cartilage is destroyed, the we get bone on bone, and the nerve endings are right underneath that, what we call subcortical bone, meaning when the bones are knocking on the bones, those nerves are flaring up and getting really inflamed. Go Tigers. What surgery do? I do orthopedic surgery. I take orthopedic trauma call, and I do mostly hip and knee replacements. Let's see what else we got over here. How long does it take me to do a knee replacement surgery? It takes me about an hour to do a knee replacement operation. Is a pain pump only for the back? No, you could use a pain pump in other places. A pain pump usually delivers some medication that relieves pain, and I'm not using a lot in my knee replacements though. Do I perform boutonniere surgery? No, my boutonniere would be for a finger, and my I have done it before, but my partner is a hand and upper extremity specialist, so I send most of my finger stuff to him. Polytrauma, which means a patient comes in from a motor vehicle accident or some type of fall and breaks a bunch of bones, that would be a very time-consuming surgery. Yeah, if you have any questions, yeah, ask away. I'll try to get to them. The chats are going quick, so I'm trying to get to as many questions as I can. It takes me about an hour to do a hip replacement as well. How do you stop the swelling in the back of the knee? I really recommend the ice machines. They are great to decrease swelling after big operations. Thanks for the share. Thanks for the follow. Really appreciate it. Spine stimulator. Spine is tough. When you have spine pain, it becomes hard to overcome. Pain medication philosophy, I do. So my first line medications are Tylenol and Celebrex. Those are baseline. Neither of those are narcotics. Tylenol is acetaminophen, and Celebrex is an NSAID. Then the next level up, which is for medium pain, is Tramadol, which is a low-level narcotic. And then on top of that, there is oxycodone. And all of my patients have access to those medications. If those medications do not adequately control people's pain postoperatively, I will adjust those medications. But pain medications and pain control after surgery needs to be appropriate. So I do a minimally invasive surgery. I cut less tissue. I cut less bone. And so that helps with pain. Am I Lebanese? Yes, I am Lebanese. Harb is a Harb is a common last name in Lebanon. So thank you for asking. Ketorolac, yes. So injection of Toradol. I do an injection of Toradol. That's usually in my intra-articular injection, but I will sometimes give it post-operatively. What antibiotic are you using before orthopedic surgery? I give my patients vancomycin. I give them Ancef before every operation. I also have them scrub their nose with mupirocin. Yeah, that's great. Is she Lebanese as well? There seems to always be someone with a Harb last name. Why do I give Vanc? So there's good literature in Journal of Arthroplasty, which is the big hip and knee replacement journal, saying that patients who receive vancomycin with the Ancef before a joint replacement procedure have a much lower infection rate. So that is why I give Vanc before all of my operations. Infection in orthopedic surgery is one of the worst complications you can have. It is incredibly debilitating to a patient, so I will do everything in my power to try and prevent an infection in one of my patients. Any bad experiences while operating on someone? So as a surgeon, you're trained to take care of any complications, anything that may come up that you don't that maybe you don't expect, but you're always ready for A, B, C, D, and you have a backup and a backup and a backup, so you're not caught with your pants down in the operating room. That's the worst thing that can happen. What's the worst thing about being an ortho? I don't know. I enjoy my job. So I think the worst part of medicine in general is that um, the whole system's just collapsing in on itself. I could go on for hours about this, but there's a lot of problems with hospitals. One of the things, I'm in private practice, so I try to avoid hospitals as much as I can. I still do some operations there. I take trauma call there, but there's a lot about a hospital that things move slow, things aren't efficient, get a bad rap, there's overspending, there's waste. Staffs aren't always happy. So I operate mostly at my surgery center, and then I have private practice office, which I see patients in. Thanks for the follow. Appreciate it. Tib. Pitting edema. 12 weeks since I blew my ACL. Pitting edema is your body trying to heal. So as you heal more and more, maybe when you're a year out from the operation, you'll have a lot less swelling, but swelling can be there for a while. No, so With increased ANSEF and VANC usage, are you worried about antibiotic resistance? And that's not where the antibiotic resistance issue is. The antibiotic resistance issue is from primary care providers overprescribing antibiotics for viral infections, which we know we shouldn't do. For a single dose vancomycin and a single dose ANSEF, you are not creating antibiotic resistance. I've had patients where I have fixed their first knee with vanc and ANSEF, fixed their second knee, fixed their hip, fixed their other hip, and they had 4 joint replacements. They got vanc and ANSEF every time, and they never developed an antibiotic resistance. So, or developed any antibiotic resistant infection. So it's not from orthopedics where antibiotic resistance stems from. What do I do for closure? I do what's called a plastic surgery closure. I use a skin tape and glue, and that's called a perineal dressing, and I'll put a Mepilex on top. It's a waterproof dressing, and works pretty well. Yeah, I do broad spectrum to cover all the bacteria, try and prevent any type of infection from happening. How long is a hospital stay after a hip replacement? Well, most of my patients go home within 2 to 3 hours after their hip replacement surgery. I do over 70% of my surgeries outpatient. Do I do shoulders? I have in the past, but my partner, who's an upper extremity specialist, I have do most of the shoulders. But if you have questions about shoulder surgery, I could probably answer them. Scapular winging. Scapular winging is a very difficult problem to treat. What kind of surgery did they offer you? There aren't really good surgeries for scapular winging. You could maybe try and do some muscle transfers, but it's a difficult surgery with not the best success rate. Yeah, I use what's called Dermabond Perineal. It's good. Patients heal well. People who are keloid or hypertrophic scar formers, they don't have a lot of issues with them. Hey, how's it going? So I do a plastic surgery closure for all my patients. Also, you don't have to take staples or stitches out, which is great. People like it. I will say hip and knee replacement does become second nature. You get in a routine. Obviously, there is extensive planning, but that extensive planning is done over and over and over again, and so it is like second nature. Hernia surgery on Thursday. Well, I wish you the best of luck for that operation. Hope everything goes well. Had a knee replacement 7 months ago. Doctor says it's loose, wobbly. Should I get a revision? It depends what was done. Was it put in, cemented wrong? Was the size not right? Did it just loosen over time? But if it's unstable, it's probably going to get worse, and you may need a revision. Do I do revisions? Yes, I do revisions. Does silver tape really help with keeping infection down? No. All the studies that have looked at that are no difference. Sometimes we'll use silver impregnated dressings, but there's no real support for it. Yeah, I shaved. I actually shaved like not that long ago, so it's getting a little scruffy in my videos. So I needed to shave. Yeah, but I think I look younger without the beard. Do I do inguinal surgeries? No, those are for the general surgeons. Thanks, man. Yeah. My goal, there's a lot of ways that you can, get your name well known in orthopedics. And I think one of the things that will be the future of kind of education and medicine in general, and it's just like everything else has gone, is having a connection with patients, doing things like this, doing live streams, creating educational content, really connecting with the community is not something that we've always had, right? In what world 5-10 years ago could I click a button on my phone and start answering people's medical questions? So this is new, and I think this is going to be great for the future of medicine and helping people in general. And my goal is just to educate right now. No, I do orthopedic surgery, so I do bone and muscle surgery, but it is bones like your humerus, femur, knee bone. I've done spine surgery in the past. I mostly do hip and knee and orthopedic trauma right now. Orthocincy is a good place. Let's see. Thursday, having a manual manipulation on my knee. Yes, so when we do an manipulation under anesthesia, we make you relaxed. A fracture can occur. I will say if you do the manipulation correctly, then that's a very low risk. Do I use a Hanna-Table? Yes, for my direct anterior hips, I will use a Hanna-Table. Thoughts on Rooster comb and PRP. So Rooster comb is what's called a gel injection. It provides nutrition, some lubrication to the joint, and that can help with arthritis if you're not ready for a knee replacement operation quite yet. Most challenging case, probably a polytrauma that came in, a patient that was fell from 5 stories and broke everything. I've had 5 ACL surgeries. What's the reason it keeps tearing? Well, if you tear your ACL and the kinematics of your knee is off, meaning how your knee bends is off, or you have an autoimmune disease, then it's going to keep failing. So it may ultimately be a knee replacement if it keeps failing or gets worse. And some people can live without a ACL as well. So I've seen PRP being used more. I am not really a big believer in PRP for like joints and things like that. There's not that good literature on it. It is very expensive. It can cost like $1,000, $2,000. So it's not something that I'm using a lot. It's an option, but I usually recommend a gel or a steroid. Hey, what's up from Canada? Lumbar discectomy and cervical spine. Nice. Do I work with general surgeons in polytrauma? Usually the patients are stabilized from an abdomen perspective prior to me operating on them. Now, I have done surgeries at the same time, like maybe general surgeries working in the abdomen and I'm working on the leg. Have you seen AO dislocations? Usually AO dislocations can be very serious. A lot of the times patients may not even be alive after that. So it's a very rare occurrence. If they're still alive, they'll get put in some type of traction or halo device, and it's a very, very rare injury. I don't think I've ever seen anyone come in alive after that. Injections in the knee for rheumatoid arthritis are called cortisone injections. Hey, what's up from Oklahoma? How's it going? Do you have any recommendations for improving your odds of getting an orthopedic residency? So orthopedic residency and orthopedic specialty is becoming one of the most competitive. Previous, you could get a really high board exam, and that would help you a lot. They've changed the step 1 since, so I would probably say get a really high score on your board, your step 2 board exam. Some people are taking a year off to get research. Probably try and get 10 or 12 research papers if you can. Find a mentor. Definitely join up with a research group at your university and find some good mentors. Sometimes you can do research outside your university and don't have to take a year off. So those are all things you can do. Hey, what's up from Idaho? How's it going? Well, to be an orthopedic surgeon, it takes about 14 years of going to school. You do 4 years of college, then you do 4 years of medical school, then you do 5 years of residency, and then you do 1 year of fellowship, and then you're an orthopedic surgeon. To get your MD or medical degree, you just have to do 4 years of college and then 4 years of medical school. Have I ever seen, so it's called a Morel-Lavelle lesion. It sounds like what you're trying to say. So what a Morel-Lavelle lesion is it's called an internal degloving injury. So basically, the skin separates from the underlying fascia, and a large pocket develops under the skin. A lot of the times, it's most common on the buttocks area, and it can be from, like, I've seen a motorcycle driver just get super bad road rash sliding across the pavement and got a Morel-Lavelle lesion. The issue is it's very hard to heal. Sometimes the skin can completely die and necrose off. You may need a flap coverage, meaning they have to rotate muscle or skin from other places to fill it. It's very high risk for getting an infection, so it is a very serious condition. AO, I assume they're talking about like an occipital dislocation. So they may be talking about atlanto-occipital dislocation. Usually it's not referred to in that type of manner. But I think that's what they were meaning by AO. What system do I use for my totals? I use a company called Donjoy. I've used Stryker before. I've used all the companies at some point, but right now I use Donjoy. Yeah, there's only so much I can talk. Urologic conditions, I can't really talk that much about because I don't have that much experience with. But where do I practice? I practice in Washington, D.C. and Maryland. But I really appreciate the support. Thank you for all the likes and follows and shares. Yeah, I went to UVA. UVA has a great fellowship program. University of Virginia. We saw people from all over. We were what we call like a catchment center, meaning people would drive 6 to 8 hours around the area to get to University of Virginia for treatment. And so it was a really great place to train. So I went to UVA for my fellowship, my hip and knee specialization. It takes about 14 years to become an orthopedic hip and knee surgeon. So how would one become my patient? I have a link in my bio. I do telemedicine visits, meaning if you want to schedule a telemedicine visit, you'll just click the link in my bio. You can apply for an online appointment, or there's a number on my website, which is also a link in my bio where you can call and schedule a telemedicine appointment. So I do treat people from out of state and people who are not in the area. If you need any advice or second opinions or things like that, it's really easy to do and set up a telemedicine appointment with me. Grade 1 tear in the posterior horn of my medial meniscus. What is the treatment? So medial meniscal tear, we usually do conservative treatment. We'll try anti-inflammatories, bracing, ice, physical therapy. If none of that works and it's persistent, you could try a cortisone injection. That's kind of a last-ditch effort. And then the next step is going in there with a camera to try and clean things up. But thanks, guys. I'm gonna go ahead and head off. I appreciate all the views and all the support, and I'm gonna do some more of these live streams. Okay, and we'll get some more of you guys.